Hey, Dr. King. Lovely to meet you in person. Yeah, amazing. I mean, we've been, I feel like I know you because we've been back and forth in the emails, but it's great to actually eye to eye meet you. Yeah, likewise. As you know, I'm Dr. King. I'll be performing your top surgery. And then today we're just going to be doing a sort of informal consultation. I'll be running you through sort of preparing you for the physical aspects of surgery and recovery, as well as preparing for the surgery. Obviously your psychologists and GPs have sort of taken you through a lot of the everyday and mental aspects of dealing with surgery and what recovery can be like, but I'm just here to give you the anatomy of it all, and hopefully do a few measurements, take some photos, and get everything ready for surgery day. How does that sound? Brilliant. So sorry to do this to you, but formalities, insurance, legal liability, and everything. I do need to confirm some of your details that I've got already on your file. Happy to do that? Brilliant. Okay, can I just get you to confirm your name, first and last name? Yep, brilliant. Big tick. And your date of birth? Okay, big tick. Right, and I just need the street name of your address. I don't need the entire address. Okay, thanks so much. Great. Okay, and I have to make sure I've got the correct referrals here, because I have a referral from a psychologist and a general practitioner for your care. I've got a letter of advice from psychologist Dr. Stevens. Is that your psychologist? Amazing. Thank you. And then I've got from your general practitioner, Dr. Jung. Is that correct? Yep, okay, cool. I've got a referral from Dr. Jung. Amazing. Let's get as much of this on your insurance as we can, okay? Yeah. No, I don't want you paying out of pocket for this stuff. It is massively expensive to be getting surgery. So I want to do whatever we can to get this under your insurance as much as possible. All right? Yeah. Okay. So look, this is a surgery that I've performed probably about 100 times now. It's something that I'm starting to specialize in and feel quite passionate about, because I can see how much it really positively affects people's lives, whether they're transitioning or whether they just have some kind of dysphoria about their chest. And then I also do the same type of surgery on males who have gynecomastia. Yeah. So look, I've seen it all. No need to feel embarrassed or sensitive, but I totally understand if you don't feel entirely comfortable at the start. Obviously, there's a lot of vulnerability involved in going through top surgery and sort of facing that head on. But props to you. You've done all of the the psychology screenings. You've got the referral from your GP, so I'm sure that wasn't easy, and you've done a fantastic job at getting that done. So props to you. I'll explain to you a bit about what the procedure involves, and then what you could have sort of expect for your end result, and then certain factors that might impact that. So obviously, top surgery in your case will be a bilateral mastectomy with reconstruction of the chest. So in layman's terms, we take out the breasts and then we reconstruct a more masculine looking chest, including reshaping, resizing, and placing the nipples in a way that feels comfortable for your personal expression. Yeah. Does that align with what you're expecting for this surgery? Brilliant. So we have different ways that we do this surgery depending on the amount of breast tissue that is there. Sometimes if someone has small enough amount of breast tissue, we're able to do a keyhole surgery, which has very minimal scarring. However, it's only sort of applicable for people with quite a small chest to begin with. But a keyhole surgery just involves doing the entire removal of the breast tissue through one hole, and we get everything out, and then there's no big long scars. Unfortunately, most of the time we have to do a full double mastectomy. It does have some scarring underneath the chest. However, I've been seeing a lot of success with my clients who then, after they get the surgery, they build quite a bit of muscle in their pectorals, and then the scar hides nicely under that muscle. Is this something that you've looked into? Are you comfortable with the scarring? Okay, yeah, wonderful. I'm sure. No, thank you, and I'm very grateful for your GP for taking you through that. Regarding scarring, so scarring is not going to look the same for everyone. Everybody heals differently. Okay, some people, especially, it tends to happen more when people have a higher amount of melanin in their skin, so people with darker skin. However, this can happen to people who are very fair-skinned as well, is sometimes keloid scars can develop. And these are just scars that have healed in a hypertrophic way. A hypertrophic scar is when instead of a flat laid scar, the scar sort of bubbles up and can be quite thick and protruding in appearance. This is always a risk when we do surgery, unfortunately. And I do encourage you to have a look online and make sure that you can see some photos of like hypertrophic scars and some keloid scars, just to make sure that you're comfortable with that potentially being something that could happen. It's unlikely, but it could happen. Have you had any keloid scars in the past, like on your ears or anywhere that you've had an injury? Okay. Well, that's good to know. You're definitely low risk, but it could happen, and I need to let you know about that. The downtime from the surgery, look, it is a pretty big surgery, so we're looking at anywhere between 6 to 8 weeks before you're back to mostly normal function. Yeah. The first 2 weeks are pretty rough. Yeah, they're not a fun time. You will have drains coming out where the scars are, just draining out that excess fluid as your body is trying to heal itself from. Surgery is essentially it's a type of trauma that we're doing to the body, and so the body definitely reacts in kind, quite a bit of inflammation, discomfort, swelling. But yeah, generally in about 6 to 8 weeks you'll be able to complete most of your normal tasks. How does that? Have you been informed of this? Yeah, okay. No, good on you. You've done a lot of research. It's great. It's great to see. Honestly, it's amazing to see it when people do their research. Yeah, that's great. It's good to know that we have a good understanding. Informed consent really matters. Okay, just write some notes quickly. All right. 1 second. Give me 1 second. Patient exhibits. Awesome. Now I need to do some measurements. Are you comfortable to take your shirt off? Okay, appreciate it. Do you want me to turn around? Turn around? Yeah, that's all good. Okay, just let me know when you're done, alright? Hold on. Okay, so if you're uncomfortable at any time, just let me know and I will stop immediately and we can pick up another time. Alright? Yeah. All I need to do for your measurements, I need to get a measurement around your rib cage. I need to get a measurement around the peak of your chest. And then I need to get some measurements from your underarm to your nipple and the diameter of your nipples. Are you comfortable with that? Amazing. I also need to do some markings on you so I can take some photos, use them for the surgery. It's okay. Thank you. If you feel uncomfortable at any time, you just let me know, okay? Because we can always book a second consultation. We can always book a follow-up. Yeah. Your comfort matters, okay? Okay, let me just get my measuring tape. Okay. I'm just gonna get, if you can lift your arms up for me, I'm just gonna get around your rib cage. Just come around here. Just come around here, get your rib cage. Okay, just give me a second here. Okay. Get this one. Okay, amazing, thank you. Let me write that down. Yeah, I've got a terrible short-term memory, so I forget the measurements almost. Like they come in to my head and then they're out the other side. Right, so this is centimeters. Can I? This part might be a little uncomfortable. Can shut up. I just need to get around your chest. Okay, let me just do this. Get around there. Get around your chest there. Okay. Okay, good. Okay. Okay. Thank you. Thank you. Alright. Thank you. Measure this. Centimeters. Okay. Just need to get, if I can get you to put this one under your underarm. Yep, just get this one to the nipple. Good to see how many this is like that. Okay, right. Thank you. And then the other one, get this. There, this. Right. Our left and our right. Centimeters. Now I've got to get my little end. I'm just going to get the diameter of both of them. Okay. I'm going to see how much we need to shrink these. Okay, that's about 2 centimeters. Okay, and then with the other one. Okay. That's all the measuring we need to do. Okay. Okay, we got the left. Centimeters and the right. Centimeters. Cool. What's your favorite color? Purple? Purple it is. Okay. You don't mind if I do some markings on you? Okay, right, you can look up at the sky if you want, or you can look at me right in the eyes, I don't care. And again, if it's uncomfortable, let me know. After I do the markings, I'll just take some quick photos. Don't worry, they're just going to be going in the database, and we will use them for the surgery. Okay, I just get this. Let's get this one here. Yeah, I'm sort of looking at where the fat distribution is. Sometimes people have it more up. They have the fat and like mammary tissue up in their armpits, and then some people have it closer to the center. Okay, let's just go this. Okay. This one gonna get a bit smaller, and that one there. Okay. Gonna get a bit smaller, and that one there. Alright. Great. Can I take some photos for the surgery database? Thanks. Great. Yep. Take it under, that way get it under. And top down, can you close your eyes? Close your eyes. Okay. Look at that side. I'll get you to turn around to the side. Look that way. Thank you. Okay. Turn around to the other side. Okay. Brilliant, that's all we need. I'm going to, you can put your shirt back on. That's okay. Yeah. Do you want me to turn around again? Okay, you don't mind? Alright, wonderful. So what I'll do is tonight I'll send you some mock-ups of what your chest will likely look like after the surgery, with the scars included as well. And I'll get you to just review those. If it's something that you still want to move forward with, then book another appointment with me and we will do the surgery on your next appointment. Yeah, we've got 24/7 access to the private hospital, so long as your insurance can cover it, it won't be of any extra cost to you. Does that sound good? Look, happy to help, always. Okay. Yeah, but yeah, I'll email those through to you, the photos with and without the changes, and maybe I'll give you like maybe one or two different options, so you can see maybe a more dramatic and a less dramatic outcome that we can do. And of course I'll get my assistant to offer you the entire pamphlet that has the entire the list of everything you need to buy for the post-care, and then she's got links on online for everything to get the best prices. And yeah, even things like, obviously it says things that you should avoid coming up to surgery, no smoking, limit your alcohol, limit your fatty food intake. We kind of want everything to be as low inflammation as possible before we get the surgery going. Yeah, but yeah, everything else looks good. Okay, well, it was lovely to talk to you, lovely to see you in person, and yeah, I'll flick those images over to you tonight. Okay, all right, see ya.